fully answering that one care ataupun the shift system. But can you imagine 1 hour just on that? No. You know, that one, in fact, I'm not representing Ministry of Health. Yeah, and I would like to disclaim that because I'm in the university. My ministry is Kementerian Pengajian Tinggi. Yeah, I don't have to answer my minister, yeah, yang dekat Ministry of Health tu tak. We are joint venture, yes, but he's not my minister. My minister is the Kementerian Pengajian Tinggi punya minister, faham kan? Sebab tu saya juga tidak mewakili Ministry of Health. Cuma saya memberikan sedikit maklumat saja. But they are all there in the internet, and I would propose, mostly, misalkan, if you really need to have a briefing, particularly to the final year, then you better ask the officers to get somebody, Ministry of Health official yang datang ke sini ke Europe ke singgah sekejap and explain. I think that is actually your right. Yeah, but I'm not trying to tell you what is happening in Ministry of Health, and if you are asking me those questions, I will not answer. Yeah, for a very good reason that I'm not representing them. Yeah, because I have my own opinion juga kan. Yeah, nanti korang masuk dalam blog tu, anda kata, ya, healthcare kat Malaysia tu teruk. You know, I'm going back there. Yeah. So I'm not representing Ministry of Health. Is that okay? Yeah. Tapi hari ini, let's talk about becoming 5-star medical doctors, the extraordinary Malaysian young doctors. Yeah, and most probably in the context of serving Malaysian health sector. So of course you have to understand a little bit of it. Let's see how it works. Next page. Okay. Alright, this is the content. A very important slide in the public speaking is this slide. After this one, you're telling who you are, the topic tu is this one. Yeah. Yang ini. Sebab ni you are telling and engaging to your audience that these are the content of what you're going to talk about. And if any one of you sitting there, tengok ni, alah ni semua aku tahulah. So, tak naklah duduk sini. So, you nak tinggalkan dewan ini, it's okay. Yeah, because otherwise kau duduk sini, kau kacau orang. Tapi if you look at this content and you know that there is something or you want to know all about it and you decided to sit in after this first slide, then it becomes a mutual engagement and a mutual understanding that you will sit there properly and don't kacau me because you want to listen to me. Yeah? And that also include, I'm sorry, not engaging yourself with your electronic gadget. Yeah, I found that, you know, nowadays with you all dengan apun the iPad, iPhone, whatever tu it's very difficult to engage you. Hence, if you are actually going to look into your own screen rather than this screen, I'm afraid you might not benefit much from this. So siapa yang tengah hantar text message ke apa-apa tu, kata Dr. Hakim salam, sends her warmest regard. And I'll get back to you after this. Send. Yeah? Boleh? Why? Because it's very distracting. When I'm talking, you're looking at something else. And I'm sorry, it's a bit disrespectful. I travel all the way to see you. Of course you want to see me also, kan? Kalau nanti tengok iPad tu kan, tu nanti boleh buat. Boleh? Mengangguk lah ya. Nanti kalau pun nampak kau buat macam tu, I will just single you up. Okay. Can we agree? This is it? Fauzi dengan siapa tadi seorang lagi? Aizat. Nai. I really need come on, Kalau kena ada pelincir ni, I'm gonna need my voice, Now when you look at life circle and your life cycle, then of course we know before life there is life. Either you believe it or not, but there is life before life or pre-life. But then we are going to go into this life and exit we do. You jadi doktor nanti. You tahu every day orang mati. Every doctor will experience his or her first death. Patient's death. Apalah. Kalau your death lepas tu tak ada lagi lah. Now, what I mean to say, patient you mati on you tu. I do not know. Dr. Halizah would have her own experience. I would have mine. Nampak orang mati betul depan you tu. And these are usually meant to be untuk orang tua-tua kan. Here you are, baru 24, 25 and facing your first death. And what more if if your consultant kata, you are the one who caused the death. Lepas tu you kata, okay doctor, I resign. So inilah dia, but we have to know about all this, because definitely, in this life cycle, it was preceded by a life before life and then life after death. But then of course we have our birth, and then childhood. You would have gone into your adolescent, then young adulthood, like what you are now. I'm into my kiranya dah, mature adulthood, and then of course, we will actually go into death later on, okay? But of course you know that sometimes that does not happen. Birth, tiba-tiba terus saja death. About 5 minutes, the baby is breathing, suddenly died. Or maybe born with ABGAS score of 7, and then suddenly become 5, and then pronounced dead. So that's an early neonatal death. So, but sometimes they might be, coming up to 4 or 5 years. My own son actually reached 4.5 months. So suddenly, sudden infant death syndrome. So, goes to death. Ataupun adolescent, pun boleh juga pergi situ. And of course, lepas tu adulthood. So this is the life cycle that you and me has to be in contact. If I'm talking to engineering student, this might be sounding so remote. But because I'm talking to medical student, this is very close to you. Betul ya? So, now let's look at this blood. Yes. Let's just watch this. Boleh? Okay, jangan fikir banyak kali ni. We need the voice.
This is shock.
Dim the light, please.
She was born just a few hours ago. Like most of us at birth, there's really nothing to her. A bit of fat, a little sugar, a bit of protein. Actually, she's 75% water.
The subtitle is Indonesia,
chemicals. And yet, she's the most complicated thing on earth. And during her lifetime, she'll achieve the most amazing things. For nearly 3.5 years, consuming 7,300 eggs, 160 kilograms of chocolate. She'll produce 40,000 litres of urine and spend over 6 months on leave. She will triple 145 litres of saliva before her first birthday. She'll crawl 150 kilometres before she's 2. Then on, she'll learn a new word every 2 hours for the next 10 years. She's 10, her heart will have beaten 368 million times. She'll spend a little over 12 years watching TV.
This is before the computer now,
2.5 years on the telephone.
Now even longer, with the headphone.
She'll spend 2 weeks kissing. 28 meters of fingernails and 950 kilometers of hair on her head, and more than 2 meters up her nose. By the age of 21, she had breathed over 3.5 million balloons of air. She'll work for a total of just over 8 years. And she'll produce...
There is not a doctor. A doctor will have been up to 15 years.
She'll be able to put a name to 2,000 people. 150 of them she'll call her friends.
Okay, that's it. I can go on and on, but this is the extraordinary you and me. Even, if you rasa you are ordinary medical student, no, you are actually extraordinary. And there's no reason why you can't be an extraordinary doctor as well. Next slide. I need help with that. Yeah, okay. So being a human being, yeah, not just that physical being that we have, yeah, the body, but we also have this, yeah, dia punya pointer ke? Tak ada tak ada bateri dia, tak apa. Yeah? The body, the heart, the mind and the soul, yeah, we are all made up of this. And because we live in, yeah, among friends, among others, so we also have our, yeah, society dimension, yeah, social component of our life. Now, I just want to go very fast on this Maslow hierarchy of human needs. Yeah, Maslow kata kita ada needs yang, yeah, very basic, which is actually, siapa belajar ni? Everybody learn. Yeah, okay. Then the more reason. Kau faham ke tidak? Tak tahu, tapi tak apa. Let me teach you how. Yeah, most probably slightly different than how your teacher teach you. Yeah. So kalau you tengok, yeah, the bawah yang bawah sekali tu is your body need. Yeah. Tak apa lah, is you click. Yeah. Tak apa ni, I think battery dia. Okay, yeah, the body, that needs the breathing, yeah, you need oxygen, you need food, you need everything. And as a doctor, we are just there. We are just trying to make sure that people will breathe, people will have their food, yeah. If not, you will have to put in the total parental nutrition into the vein. Yeah, if they are vomiting repeatedly, you have to actually hydrate them. Yeah, suddenly dah blue dah, tak boleh bernafas. Then you would have to intubate them and hook them to the ventilator. Whatever, asalkan dia hidup. Yeah, so we are actually serving them. Dia tak boleh tidur, you bagi dia buat tidur. Dia tak boleh ada seks sebab tak ada erection, you bagi Viagra, habis cerita. Alright? And then kalau misalnya hyponatremia, you just give sodium. Hyperkalemia, then you have to start your cocktail. Yeah? Dia tak boleh nak BO because there's an intestinal obstruction due to rectal CA, for instance. Then we have to do something, resect, and most likely we just have to do, yeah, some stoma, yeah, into the anterior abdominal wall. So, boleh pakcik, boleh discharge. Because dia dah ada that very essential need. Otherwise they'll die. But human being tak boleh kat situ je. We will be exactly like animals. So we need other things, split lagi, which is the safety, security of your body, your future, yeah, your income. That's why you all belajar berapa tahun kat sini ni, sebab nak jadi doktor. Yeah? Lepas tu baju besar, yeah? Orang panggil aku doktor. Alright? So this is actually the safety of your mind, and this is what you need. Yeah? Klik lagi. This is what your mind need. Cukup tak tu? Tak cukup. Yeah? You need to be loved and be loved tu yang orang dah kahwin dah. Yeah? Milik siapakah hati ini? Macam tu kan? So mulalah. So kat sini the word sex comes up again because this time, yeah, we are not like animal. You can just have sex with anybody down the street. We must have sex with somebody, yeah, whom we develop intimacy, the emotion part of it. Now you need to have your self-esteem, respect, confidence, and this is the need of the click needs. Kau jangan buat Melayu, ya? The need of the heart, yeah? This is actually the emotion. Is that enough? No, anak-anak. Yeah? You have to go to the other level, which is the self-actualization. And if you don't go there, that's why you always feel the emptiness in you. Yeah, because over here, you ask the question of, why am I here? What am I supposed to do? Is this world a better place because I'm around? All those questions. And this is the self-actualization, the needs of your, klik lagi, Muiz, yeah, the spirit. Yeah? Next. Yeah, alright. Yang ini ni Maslow kata, if you don't actually go to all your needs, yeah, and in fact you deliberately plan being less than what you are capable of achieving, then I warn you. Maslow kata, Maslow kata. Ini memang I ambil daripada dia kata. Then I want you that you will be unhappy for the rest of your life. Siapa yang tengah merasa unhappy tu, ya, orang dah hantar jauh-jauh kemari still rasa unhappy tu, most probably you have sort of told yourself that I'm not going to achieve my potential. Biasa-biasa cukup lah. Korang ni bukan boleh biasa-biasa. Your result patutnya, ya, masuk level yang luar biasa. Kalau biasa-biasa, itu nanti ya tak payah datang kemari. The fact that you are here is because people see you have the potential. So fight. Ya, work very hard. Tak cukup, Allah nasib baik lulus. Ya. Tak cukup tu, itu yang yang you rasa unhappy tu, because that is not where you should be. You should be better than that. Yeah. Okay. Next slide. Who is a doctor? Yeah. Yang ni I ambil daripada Malaysian Medical Association. Yeah, a doctor must be a medically qualified. Thank you. Yeah. Medically qualified person. That's why you need the training. Ada some 5 years, ada 6 years, ada yang daripada foundation 7 years. Yeah. And once you are qualified, your work is to prevent disease, to relieve suffering, to treat the sick, which is the patient, and to provide care. These are the definition of a doctor. You better know this. Kan dah jadi doktor tiba-tiba tak faham rupanya. So ini definition. Next slide. Okay, what do doctors do? So these are basically what we do. The most important one are this one. You examine, you diagnose, you treat the illness of patient. But is that enough? No. Jadi medical student, you kat atas tu aja. Nak belajar yang atas tu. And then of course you have to administer and prescribe the right drug. Okay. And then nak perform procedure atau surgery ni is nanti masa you dah jadi doktor tu. But this is our job. And macam I tulis guys tu, patient everywhere. And not only that, you also need to disseminate public medical education. You need to be a part of the health system. Bukan saja dekat hospital aja macam tu. Okay, next slide. Then who is a patient? Ni kalau you tengok, patient tu pula is equal to person plus disease. Betul? I'm sure you all still remember your mathematics, kan? What I miss most in my medical student days was physics and maths. Because that was my strongest subject. Tapi nak jadi doktor. So my physics teacher nak pengsan bila dia dengar. Dia kata, okay Harlina, you nak jadi apa? I nak jadi physician, Prof. Doktor, cikgu Physician? No, physicist kot. Dia kata kan? No, physician. So because dia kata, takkan kot. And I really miss physics and maths masa tu. So that's why come this equation. Patient tu anybody, person, tapi with a disease, baru you panggil dia patient. Betul? Saudara siapa nama? Kevin. Interaktif kan Kevin? Now, let's say you have a person with a huge uterine fibroid. Apa nama patient tu? What is? She is a dash patient. Thank you. Betul lah. She become a gynecological patient. What about her heart? Her heart is fine. She's not a cardiology patient. Betul? She has to be going through dialysis 3 times a week. So she's a nephrology patient. Katalah you have treated her. Yang fibroid tadi tu, Calvin, I dah buang dah. So she's no longer my gynecological patient because the disease is gone. So klik lagi Miss. Lagi. We spend 6 to 7 years learning how to doctor the disease. You travel the world, half the world over to learn how to doctor the disease. But I want to ask you, how many years do you actually learn to doctor the person tu tadi? Klik lagi Miss. Jangan takut aku bangga dengan apa. How long do we actually spend learning to doctor the person? Doctor is a verb, it's an action. Doctoring. She doctored the patient. Doctor tu bukan nama je, it is also a verb. So how do we learn doctoring our patient in the person punya perspective, not just the disease? Itu yang you tengok patient, you tak ingat nama kan? Anda ingat nama patient you? Oh, kau ingat aku tak ingat nama kau alah, itu tujuh tu, si bacterias. Nama? Nama. You don't remember the patient's name. All you know is all the diseases. For us, muka patient tak ingat. Tapi bila tengok buat kat sini, pernah nampak sedih sini. Punyalah dahsyat je doktor ni. But you know, if you can recall your patient's name, wow, your patient feels so happy pun. Apa pakcik masuk Pakcik Alif kan? Ni Alif tu kan, nampak? Pakcik Alif kan? Doktor ingat nama saya doktor? Mesti ingat. Alif Batam cik kan? And then you will see this patient coming every time, you all punya appointment. Never miss the appointment. You see, a good patient It's possible if you are a good doctor. But if your patients are all very bad, there is the time for you to look in the mirror and see yourself as a doctor. Teruklah patient I ni tak makan ubat, I suruh ni. Rupanya kau tu dulu yang crooked. If you are a good doctor, you will see patients wanting to be good, patient wanting to comply, patient wanting to impress you. Makan 2 kali dia makan. Pakcik datang pukul 9 dia datang. You see? Alright. Next. Now this is the 5-star doctor. What hotel is this? Berapa star ni kan? Adalah star ni kan, aku rasa macam 3 kot. 4, 5. 4, 5 lah. But the point is, you know, all this star ni is actually the quality punya measurement, yeah. But we want a 5-star doctor. Who are these 5-star doctor? Look, when I put the healer, aku bukan cakap clinician ni. Some of you bill doctor tu, cardiology, neurosurgeon. No. To me, the most important doctor is the one in the community, yang boleh, sebab dia bagus in detecting diseases macam Dr. Halizah ni, so that malam, I boleh tidur malam I on call. Kalau Dr. Halizah tak boleh detect pre-eclampsia, sampai patient tu eclamptic kat rumah, datang kat hospital I masa I on call, I tak tidur malam tu. So I put there, healer dalam golongan clinical or non-clinical. Another group of doctor in the Ministry of Health. Oh, they work very hard to make sure that the health system works. Tu nanti I cakap sikit. Okay? So, you must have all these 5 character. You are a community leader because you have to lead. You nanti jadi doktor, namanya house officer. Ada my student itu, Prof, kenapa house officer, Prof? Because the ward become your house. Betul. You are expected to sit there, live there. So kalau you tiba-tiba, I cannot go on. Kenapa? Hospital phobia. Ada baru ni, we were discussing. Of course, first we laugh macam nak mati lah. Lepas tu kata, macam mana boleh jadi hospital phobia? Dia nak on call aja, dia dah tak boleh tidur. Phobia sangat datang hospital. Pasal kau jadi medical student dulu, kau pergi hospital mana? Jadinya macam-macam lah. But you have to lead, you have to lead those people in the ward. Walaupun nurse you tu dah 20 tahun bertugas, lagi tua daripada you, because you ada MBBS, you ada MD, you immediately become their leader. Okay. Then you also have to make good decision. Especially those of you yang tak pernah buat decision, I better warn you, semua mak dengan ayah decide, kawan-kawan decide. You hardly make decision. Datang ke check ni pun mak ayah kata pergi. Kawan kata okey, kita pergilah ni, yang OSEM ni pergi. You never had your own opinion. Siap you jadi doktor lah. You nak discharge pun tak discharge patient ni. Nanti kalau tak discharge, macam mana pula? Kalau discharge, kalau dia mati kat luar tu, macam mana pula? So, tak payah discharge. So, patient kau penuh je kat bawah. Dia kata, macam mana ni? Dia kena ada turnover sebab we need new bed. We need beds, empty beds because ada patient lain nak masuk. Boleh tak kita letak double decker, doktor? So, making decision. You all senang je kan? Siapa pernah masuk hospital, you know. You really want to know whether you can be discharged atau tidak hari tu. And you have a lousy decision maker as your doctor, siap you. You rasa macam okey, boleh balik doktor? Kejap. Nantilah saya tanya saya punya superior. You tak jadi houseman sampai bila-bila tau. Masa you jadi houseman tu, you must learn when to discharge a patient. Then what happen if, how are you going to make sure that the situation is good enough for them to be discharged? If all this requirement is not met, then the patient need to be in the hospital. Sampai bila? Then you have to decide on that. Oh, besar decision ni. I do not know. I love this part. I love making decision. Good decision. Most probably because I was trained daripada kecil. You all ni yang tak biasa buat decision, ini yang paling you takut. Nanti kita belajar petang. Critical thinking, decision making. Communicator, you need to communicate. Mesti boleh communicate this one. Nantilah senang-senang I cerita lah. A very classical story about communication ni, of a doctor. Bila pakcik ni kan, dia ada SLE, all the symptoms tapi makcik ni dari kampung, isteri penghulu, duduk dalam hospital, tak ada orang cakap dengan dia what happened to her. Tanya doktor yang houseman yang tengah marah-marah tu, dia kata Makcik, doktor, makcik sakit apa? Makcik sakit systemic lupus erythematosus, lupus nephritis and cerebral lupus. Makcik dengar, makcik faham? Dia kata, rupanya doktor ni memang tengah sakit hati lah, orang marah kat dia. Tapi bila makcik dia tanya, makcik faham? Dia kata, macam nak kata, faham tau? Makcik kata, tak apalah doktor, dengar lupu-lupu je kan ya? Nak tanya profesor ke doktor, konsultan tu, tak pernah pun tanya. Kerja ramai-ramai datang, not even acknowledging, ya? Pergi pegang-pegang lah, pergi pegang ni. Lepas tu tak cakap, makcik, berkhabar makcik, makcik sihat, makcik ni sakit, makcik ni sebenarnya macam ni. Itu sikit sebelum next patient. So lama-lama dia tanya cleaner tu. Cleaner endon tu. Sebab for our patient, dia tak tahu cleaner ni bukanlah a part of the healthcare system. Pada dia semua serupa kan. Saya ni bila lah nak balik, dia tu. Lepas tu bibik tu kata, yang kena tanya itu doktor, dia tu kan. Nanti mana cleaner tu kata, saya kira-kira besok mungkin ya. So bila nak balik bagi steroid, tak ada orang cakap yang steroid tu will take about 2 weeks. Nobody says anything. So bila dia balik, dah 2 minggu kat ward tau. 2 minggu kat ward tu, kalau ikut orang kampung macam pergi Mekah lah. Balik tu berduyun-duyun orang datang tanya, kau sakit apa marah sampai 2 minggu ni. And she didn't know what happened to her. So what did she say? Dia kata, entahlah kak, doktor pun tak tahu. That is the safest thing to say, no? Dia kata, entahlah kak, saya pun tak tahu. It's so stupid, isn't it? So the doctors are not around, so just kata lah, entahlah kak, doktor pun tak tahu. Come on, just be fair to yourself. Kau belajar sampai ke check ni, belajar macam nak rak tiba-tiba. Just because you don't communicate to your patient had an impression that you do not know what is happening to her. Yeah? So bila cakap ni dengan kawan-kawan, ni mesti sakit yang doktor tak jumpa ni. Dia cuba pergi bomoh kat rumah sana tu. Pandai bomoh. So dia pun pergilah. Now this bomoh can really communicate. Ya, dia tengoklah main. Sakit ni memanglah doktor tak boleh ubat. Buatan orang. Bukan orang lain pun, adik-beradik je. Hari tu masa sialong tu orang minta kan, akak tolak kan. Kalau akak tak percaya tengok, dah hari Jumaat mesti sidai kain kuning. Kebetulan pakcik saja kain kuning. Oh, confirm diagnosis. So, minum air ni, ya, mandi dengan air limau, air apa semua. By then, the steroid works. By then, the arthralgia works, the alopecia gone. Do you think it will be contributed to your ubat? No. Bomoh tu lah yang dapat. Ada faham ke ni? Macam itulah kita. If we don't communicate to our patient. Alright? And of course you have to manage. Yang ni important ni, manage your emotion. Nanti kita sebut. Sebab kalau you tak manage your emotion, you marah dengan patient. Puan ni macam tak tahu je saya on call. Masa saya on call pun nak datang. Why must you say like that? Yeah? So Dr. Harlina kalau misalnya ini Jonah atau Jonah? Tak tahu Jonah ni kalau you on call je mesti ramai datang. Ada masa-masa ni Jonah. Kalau misalnya selalu admission 1-2 je. Yang ni perlu on call sampai 10-12 patient duduk dekat canvas lah. Ni siapa yang Jonah sangat ni? Dia kata sangat-sangat. Doktor you pergi mandi lah, mandi bunga ke apa kan. Patient tak berhenti masuk. Dia main Jonah. So bila you banyak admission, you penat. Tapi how do I comfort myself? Okay, patient tak berhenti ni, kata kan, berhati lah. Okay, I think everybody knows that the best doctor in town is on call tonight. Barulah. Yalah, kalau tak, how do I survive the night? Kan? And remember, if you have a lot of admission, it only will make you better. Ya? Tapi jangan marah patient lah. Terima kasih puan kerana datang, gitu ya. Tak juga kan. Now, last, even though last tak last lah ya. Most important, to be a role model. You say what you practice. You practice what you say. Ya ayyuhallazina amanu lima taquluna ma la taf'alun kabura maqtan 'indallahi an taqulu ma la taf'alun. Itu bagi mukmin yang baca Quran di hari ini. Ya, wahai orang beriman, apa kamu kata apa yang tak kamu buat? Amat besar kemukaan Allah, kamu kata apa benda kamu tak baik. Pakcik, janganlah merukuk je. Macam mana saya nak buat pakcik ni? Pakcik berhenti Okey, pakcik keluar je. Break 1 minit. Kau pergi merukuk pula sendiri. Ayo. Pakcik buat apa yang saya suruh, jangan buat apa saya buat. It doesn't work that way. Okay, next slide. Now this is Declaration of Geneva. I'm trying to tell you that you are actually bounded by all this, yeah. I'm not going to read everything lah, ya. You boleh tengok lah. Tapi these are actually our promise, yeah. And next slide. This is the oath of the Muslim physician. Ya, ada you tengok kat situ, give us strength, give us to be honest, everything. Next slide. Ini ada tambahan ni panjang sikit. So make us worthy of this favorite station, and dignity. So we may devote our life in serving mankind, poor or rich, literate or illiterate, Muslim or non-Muslim, black or white. It's already very clear that we should not see any differences in our patient. Ni musuh kita ni, tapi tengah DIL, death in line. Seorang lagi tu kita punya pak mentua contohnya, tapi alah laceration sikit dekat toe tu. You have to attend to your enemy. Macam tu. Next slide. Now this is the promise of Catholic doctor. Ni tengoklah dalam tu macam-macam, korang je tak tahu. So this is actually the promise. Next slide. Yang ini. In order to achieve this goal as a Catholic doctor, I also promise. It's more or less the same. Next slide. This is Buddhism and medical ethics. Saya tak jumpa yang the oath or the promise of a Buddhist doctor. Tapi basically this is actually what is encompasses into the responsibility of a doctor who is a Buddhist. Next slide. Oath of the Hindu physician. Ada juga. Yang ini I'm referring to this. I do not know where they have referred that from. I'm sorry if it's not the right references, but I think this is a very neat. Speak the truth. Not eat meat. Care for the good of all livings. Be simply clothed. Kau pergi jadi houseman, janganlah pakai Prada, pakai all the bling bling kan. Consultant kau simple aja. Yang you macam fashion show. Dengan wanginya tu. Lepas tu bila kita rawat, kasut dia so irritating. I had actually instructed one houseman and said, look, I think I'm so irritated by the sound of your shoes. Can you at least go and get a slipper ke apa? Only then you follow my round. You just beli kasut macam kasut air. Kelak ke apa ke yang make to last, you boleh lari dengan dia tu. Kalau you pakai kasut macam tu, kalau ada apa-apa, you ayah tak boleh lari lah, seorang lain. Macam tu. Next slide. Now, are we truly the instrument of God's mercy today? These are my students, my first batch. They are going to finish their housemanship by this June. First batch tu maknanya 2005 dia orang new curriculum. And dia orang ni yang ada PPD module. So PPD module tu kalau ikut I macam input tarbiyah lah sikit kat budak-budak ni, how to talk, how to actually look and reflect into themselves, blah blah blah. So Theo is in Edwin Theo is in Ipoh, itu Nisa dekat Sabah, Aini dekat Kuantan. So these are all my student, So masa ni diorang baru grad, and they are my student yang sekarang ni tengah habis exam hari ni, for professional exam diorang. Okay, next slide. Okay, yang ni ada clip sikit. I'm sure you have seen the movie, but can we spend a few minutes? Alright, silakan. Okay, dah.
First, do no harm. Listen, you simply listen.
Kuat sikit kan? Kuat sikit ni.
Awesome power. The power to do harm. Who gives you this power? The patient. The patient.
Kuatkan sikit suara dia. Tak apa boleh kan? I have to hold it, isn't it?
Do no harm. Listen, you simply listen. An awesome power. The power to do harm. Who gives you this power? The patient. The patient. It's moment for this. Hand you a knife and say, doctor, cut me open. He trusts you the way a child trusts. He trusts you. Do no harm. The sad fact is, human beings are not worthy of trust. It is human nature to lie, take shortcuts, lose your nerve, get tired, make mistakes. Rational, patient, puts trust in human being, and we're not going to let him. It is our mission to rigorously and ruthlessly train the humanity out of you and make you into something better. We're going to make doctors out of you.
Well, ada dekat macam tu. Tapi I have problem with what he said. Yeah? Tapi kita as human being ni, we tire easily, we have shortcut. So we cannot be so human when we become doctors. So we are going to take away the humanity out of you and turn you into someone better. We are making doctors out of you. What kind of doctors without the humanity component? You'll be a robot lah. Yeah? So that's actually the question. Next slide. You are arrogant, rude, insensitive, and incompetent. Just the consultant you are looking for. Siapa yang tak faham, minta maaf lah ya. Dia kan, kartun ni dia ada kaitan dengan critical thinking sebenarnya. So dia kata kalau misalnya you nak tengok whether you are very critical in your thinking, you see how you interpret cartoon. Yeah? Okay. Next slide. Okay, sikit lagi ni. Tengok interview dia ya. I want you to watch the doctor who interview this patient.
He told me the Korean was felt like he lost.
This is a very depressed patient ya, dengan intuition.
Moved 7 times in the last week.
Doktor tak tengok pun patient.
And several times. Nothing seemed to fit.
When your father died, how did that make you feel?
I didn't know I was dying.
It was like there was this distinction between you and the rest of the world. I looked around me. I had found out just how to take it forward. But it wasn't like it wasn't Phil. My uncle helped even listen. He at least listened. And I thought, if I could like my own thoughts, I could fly the moon, or at least Uranus. What if I couldn't do that? At least I could use my ideas as a glow stick. Getting them out.
What's that? Yes, that's it. Yes, well, I think we're making fine progress. We'll talk later.
Was that a fine progress? This poor patient almost killed himself. Yeah? Very low tone, yeah? Very, a lot of pause in between. These are all signs of depression. Tapi doktor ni tak nampak, pasal tak tengok pun. Yeah? Dok sibuk ni, tengok jam. Yeah? And then at that last part, yeah? You mungkin tak berdengar apa dia cakap, tapi he was trying to see whether the doctor was listening or not. If only I can lead my own fight, then most likely I can go to the moon or Uranus. Or at least I can use my penis as a pogo stick to walk around. Tapi the doctor say fine, you make fine progress. Maknanya apa? Dia tak ada dengar pun. You know, macam ni ramai doktor macam ni. I can see some of you all. What's good to be this kind of doctor? Kamu ke tu nampak tak? Doktor ada ke kat muka saya? Okay, next slide. Okay. It might help, doctor, if you're more cordial with your patients, and then I'm a doctor, not an actor. Yeah? Okay, next slide. Okay, sikit lagi. Okay, this is the last piece. Siapa dah tengok Professionalism? Dah tengok? Professionalism? Alright, most of you dah tengok ya. Kalau tak, maybe Cemsa kena buat satu movie buyuing.
evidence of gangrene. Any osteomyelitis? No. Although nothing. Stabilize the blood sugar. Antibiotics. Probably active.
I was just wondering the patient's name.
What's her name?
Martin. Yes. Thank you. That's cool. What were you doing? Carrying on eggs and you're actually kicked out of bed.
Cannot stand him. He doesn't have to talk to me like that.
Okay. Yeah. So probably I can propose to Cemsa ke, ya, untuk adalah movie viewing session sekali kan, ya, tengok Patch Adam. This one okay ke? Kalau this one. Okay. So next slide. Tutup dulu tu. I can't read a word of this essay of yours. Excellent work. Oh iyalah, kadang ya, yang tulisan dia cantik tu, I kata tak apa. Sekarang cantik lah, tak lama lagi dia scribble juga. Tapi kalau sekarang dah tak boleh dibaca, sekarang tu macam mana ya? I don't think so. Okay. Okay, next slide. Now these are clips, newspaper cuttings that shows how doctors have a lot of problems. This is one of my colleagues when he is specialist. Well, he was charged and I think found guilty for falsifying the document in the birth registration. Ya, kita sekarang ramai anak-anak yang wanita yang hamil luar nikah without the husband, so they always want to give away the baby. So apparently this doctor engaged those couple who are childless and just put the name of the woman on the birth certificate of these babies that was delivered by another woman. And of course lah, there's some transaction of money lah, macam jual bayi juga lah ya. So when you actually katalah I ni tak ada anak 8 tahun dah, tiba-tiba jumpa this doktor kata tak apa no problem, ada seorang nak beranak this week, kalau you nak okay, bagi duit masuk account apa semua. So nanti bila bersalin aja, dia siapkan the registration form with my name on that. I never become pregnant, I did not see any doctor for my antenatal care ke apa and I didn't even have a delivery, but suddenly I have a baby. And then so I and my husband will bring this to the Jabatan Pendaftaran Negara, and that baby become mine. And the JPN officer will not actually question, betul ke Dr. Harlina yang deliver ni? Yang cop tu nama aku. Berdaftar dengan MNC. So if doctors start to do this, well, who else can we trust? Next slide. Yang ni, doktor mewah, doktor pilhayal ni. You see, kita sebagai doktor, we are licensed to hold drugs yang dipanggil psychotropic drugs. Of course, this drug ni sebenarnya drug yang disco goers ni, yang ni untuk mabuk and shabu and everything tu. But of course you cannot use it more than what your patient's loads are. But this doctor memang ada banyak, and dia orang actually ambil kat rumah dia. This is her house. Lepas tu ada Mercedes baru, kereta Mercedes baru tau. This doctor earn 10,000 a month, a day. Oh, best dia nasib baik jadi doktor. So bila masa confiscate, banyak sangat ubat psikotropik ni. Tapi kan dia tidak dihukum gantung mandatory. Padahal dia ni drug addict, drug pusher ni. Sebab dia doktor, so dia hanya di-charge sebagai doktor yang memiliki ubat lebih daripada yang didaftarkan. You see? So he definitely know the system. He just beat around it, and he could pay the fine. Alright? Now we must put a stop to this. If you are in for medicine just for the money, you are in the wrong profession. Okay? Let me say that again. I know some of you kata, mak kata, jadilah doktor, nanti kalau kau kerja dah ada. I tell you about it. Kalau you are here just for the job, this is a wrong profession altogether. Nanti you rasa, baru you perasan, tidak ada apa-apa mata wang di dunia sebanyak mana pun yang boleh bayar titik peluh you, air mata you, perasaan you, doing that service to your patient. Not even 1 million a day. So don't make this profession so cheap that you can be paid 10,000 a day and feel happy with it. So ni penting ni, kalau tak nanti bila I bawa kereta baru I, orang kata, ish, doktor tu tak apa dia jualnya tu. Boleh beli kereta mahal macam tu. Padahal it was my hard earned money. Okay, next slide. Ni MMC. Now I'm going to introduce you MMC tu apa. Tapi MMC suspend 3 doctors. Dia bila kita suspend, gantung doktor, diregister doktor, this is kita punya regulatory body. You all nanti pergi balik, you need to be licensed by this council. Tak boleh tiba-tiba je boleh buka klinik kat tepi rumah ni, tak boleh. Dia kena license dulu. Dan kalau you all buat something wrong, they are the one who is going to suspend you or deregister you, and the regulation, your name must appear on the paper. So siapa yang nak merasa nama keluar kat surat khabar kan, asyik Dr. Harlina je, aku teringin juga. Buatlah ni, tiba-tiba nama you ada lagi situ. Okay, next slide. Yang ni another 2 doctors. Apa dia punya mistake? Ada satu tu dia punya tu was having sex dengan patient dia. It was the next one. Lalu yang tadi tu, sebelum tu is mana? Sorry lah, not this one agaknya. This was another ni. Okay, next slide. Kebanyakannya MC lah, jual MC. Okay, next slide. This doctor sama dengan doktor yang first tadi, yang obstetrician tadi. Walaupun dia ni assemblyman, adalah pangkat semua, but of course MMC tak tengok semua tu. So he was deregistered. What does that mean? Deregister maknanya you tidak lagi berdaftar dan you tak boleh practice. Your name doktor ada, tapi you tak boleh practice anywhere else in this world. Hatta di Timbuktu ke apa ke. Nowadays dia punya registry is all centralized. So kalau you buat something wrong dekat check ni, you tak boleh pergi Malaysia and practice as a doctor. The Malaysian government would have checked your name. Dia tengok deregistered in Republic of Czech. Tak boleh lah. Okay, next slide. Yang ni, doktor suspended over love affair. Dia treat patient tu masuk, patient tu comatose, masuk ICU. Duk lah selalu counsel bini dia, lama-lama dia kapur je bini patient. Patient tengah ventilated lagi. Dia ada affair pula dengan suami isteri dia. You all kan, kalau you fallen in love with your patient's wife ke, with your own patient ke, then you have to let go looking after that patient. You kena minta orang lain jaga. You cannot have any love relationship with a patient who is still actively your patient under your care. Tapi kalau you kata, okay, I tak boleh jaga ni, lepas tu dia dah bukan your patient, boleh lah. Next slide. Okay. Now, instruments of God's mercy, Allah's mercy. This is very important, because you are not trying to be God. You are just God's tool, to do this job. Okay. So ni ayat Quran dan hadis yang supporting that. Next slide. Now, I have 7 steps here, to be a 5-star doctor. 1, you must be sincere, because sincerity is the best policy. So, being a doctor because you want to serve, and because this is a public servitude calling, that is what I mean. Not to be here because of the money. Yang money tu memang like will not last lah. Okay, next slide. You must be caring and pleasant. And for any one of you who are already caring and pleasant, well, you are on the right move. How do you know whether you are caring and pleasant? You ask feedback from your friends and your patient. Tanya kawan you sebelah you. Am I caring? Yes, right? Am I pleasant? Kalau tak, kau tak boleh guna komputer ni. Oh, pleasant, isn't it? Now, not only that, you have to have feedback from other people around you. For UKM student, they have to get feedback from their patient. Of course lah, semua cari yang dia ada dia punya patient feedback form. Yang sampai ke I tu mestilah semua ya kan soalannya. Adakah anda merasa selesa dengan pelajar ini? Ya. Semua ya lah kan ya. So we were arguing, what's the use? They will always submit those feedback where the patient says ya je. Dia ada ya, tidak pasti. So I said, look, we don't need the patient to tell us which of our student is not good. We have our own assessment. But at least the student, dia kena submit 5 patient assessment to me throughout the year tu, bukannya dalam sehari, tak. Jadinya ada yang memang pleasant and caring. The first patient yang dia jumpa tu dah boleh bagi yes. Ada soalan jackpot akhir tu. Adakah anda mahu dijaga dan dirawat oleh pelajar ini di masa akan datang? Ya ke tidak? Ya. So, yang budak-budak yang dah pleasant and caring ni, sekejap je semua yes. But there are students who are struggling. Jumpa seorang patient, yes, tidak pasti, yes, tidak pasti, tak pasti, banyak tak pasti. So yang ni dia tak submit lah kat I. Masuk je tong sampah. Jumpa the second patient. Dari tadi tu, daripada 10 tu 5 tak pasti. Yang patient ni adalah 2 tak pasti. Dia tak submit juga lagi. Dia submit lepas the third patient yang bagi semua ya. That is the learning curve. Okay? And I do not know how many times you have to see your patient sampai you dapat semua yes. And if you, macam my student, kalau misalnya dia kena cari 5 orang baru dapat semua yes, then most probably he or she is not caring enough. Not pleasant enough. Ada some of you ni yang pendiam sangat. Yang bila you jadi doktor, you kena banyak sikit cakap. Itu sebabnya doktor ni menantu yang paling baik. Sebab apa? We were trained how to talk to budak kecil, how to talk to orang tua. Masa saya kahwin dulu, suami saya orang baling Kedah. I know how to speak dengan pakcik yang tua, I know how to speak dengan makcik yang tua. Sebabnya the everyday job, we have to meet them. Betul anak menantu mak ni. Ini yang jenis pendiam sangat ni. Pakcik sihat? Sihat. Ada apa-apa pakcik nak beritahu saya? Tak ada doktor. Okay, terima kasih pakcik. Tolonglah riuh-riuh sikit lah. Next slide. You need to be able to celebrate diversity. Muiz saya sikit. Tak, Muiz tengah tu. Fauzi tu. Okay. Fauzi kita mungkin. Celebrating diversity and open-minded. Yang ni mesti. Nanti kan split lagi sikit Muiz. Dia ada lecture on managing diversity. I will need to teach you the skill to manage the diversity around you. You jangan ingat you pandai tu. Orang tua macam mana nak cakap dengan tua? Orang muda macam mana cakap dengan muda? Ada orang yang tengok je muka dia terus menyampah. Sebab apa? Muka macam muka bekas tunang ni kan? Contohlah. But now that person comes into your clinic and you need to treat her or him. Takkan you kata, okay, I tak nak treat dia. Siapa? Muka macam bekas tunang air dulu kan? Tak boleh lah, you are a professional. Okay, next slide. Be good role model of others. Ini surah As-Saff yang saya cakapkan tadi. Maknanya apa saja yang you actually advise to your patient, you must have done that before that. Okay, next slide. Principle centered and brave, very important. Maknanya you memang yang betul-betul lah. Yang hak itu hak, yang batil itu batil. Maknanya kalau misalnya yang depan you ni datuk sekalipun, Tun lah contoh. Tapi dia memang tak makan ubat apa semua, you kena marah dia. Bukan marah macam marah-marah tu lah, tapi Tun, saya tahulah Tun ni Tun. Tapi dalam hal ini saya minta sangat Tun tolonglah ikutlah advice saya. Berani. Bukannya there's no fear, no favor. Patient you ada 50 orang nak jumpa you. Suddenly datuk ni datang, tak tengok terus. You kenalah tunggu lancik. Sekejap ya datuk, saya nak tengok berapa orang ni lagi. Macam tu. This is actually very important. Next slide. Okay, all-rounder and holistic. Okay. Yang ini in terms of knowledge, in terms of wisdom. Sikit lagi, step 2, 7. Be humble and respectable. This one very important. Jadi doktor ni kena humble. Janganlah rasa jalan tu pun dah kat koridor tu pakai whiteboard, bawa stetoskop, Wah, pusing. Macam lasso tu kan. Doktor. Aduh, hai. Ya, you must never feel that you are great. Nanti kalau misalnya nurse kata, doktor, mana boleh pakai ubat ni? You doktor kan, doktor? Oh. Yang pergi mana? You know who I am? Banyak sekadar, ya. So you have to be really humble. Orang tak tahu you doktor pun tak apa. Ya, but dia sebenarnya lagi humble. If you are a doctor, you are more respectable sebenarnya. Next slide. Contemporary and updated. Ni baca jurnal-jurnal semua ni. Janganlah yang jadi you seorang aja doktor seluruh Malaysia tu yang still guna ubat tu. Ya, ada satu cerita. Aminophylline. Aminophylline dah lama dah orang tak guna untuk asthma. You know, but there's one doctor in the up north of Semenanjung Malaysia who still using it. Sebab dia tak pernah pergi all the CME, Continuous Medical Education, tak pernah. Jadinya aminophylline is provided by one drug company. Drug company tu nak dapatkan aminophylline pun dah payah sebab satu dunia dah tak guna. So sampailah kena bos dia yang pergi jumpa doktor yang dah lama ni, respected and respectful doctor ni. I said, I'm sorry doctor, can I request that you stop using aminophylline because nobody else in the world are using it. So we cannot just producing it for you, isn't it? Janganlah memang macam tu sampai obsolete sangatlah, ya. Dah ketinggalan zaman, Jurassic Park berapa tak tahu. Next slide. Now this is the part yang boring sikit lah. Boring sebab apa? This is where you're gonna work, tahu? But hate you must, but of course you must love juga. This is love-hate relationship lah. Ya, hari tu kau nak kerja ni sebab apa, nak jadi doktor nak kerja kan? Maka sini lah tempat kau kerja. Ya, okay. Health sector. Next slide. Now, as I said, it's just at a glance. Ya, information yang saya ada ni semua you boleh dapat dalam internet. So I'm not going to detail out as if this is actually mine. Ya, my punya information. Ya. So kita tahu kita ada universal healthcare system, public and private sector. Next slide. Yang public is actually Ministry of Health. So you can see the public sector is actually delivered by the Ministry of Health as the main delivery. You ada juga local authority, macam contohnya di BKL dia ada klinik dia sendiri. So kadang-kadang all the agency kerajaan ada juga. And of course the private tu they have either clinic saja ataupun hospital. So they are quite multi-system. Now I think Zain, saya rasa amat perlu you all tahu what is the background of the health system. But in your curriculum supaya you learn about the Czech Republic punya health system. Now when I want to become a doctor, I was advised by my teacher, Puan Nurjah. Dia kata the best place to learn how to become a doctor is where you are going to practice. Not saya nak kalau aku tahu aku balik Malaysia. Tak bukan macam tu. Cumanya when you are here, of course you are more familiar with the diseases of the local. And when you travel back, kita dah lah dekat tropical semua tu, so you need some adjustment. So janganlah marah kalau orang marah-marah you, sebabnya memang you kena belajar lagi. Masa tu I actually rejected 6 ke 7 overseas punya offer masa I lepas SPM tu tahun 84. Yang tadi tak nak sebut kan tahun 84. Korang tak lahir lagi, zaman Azali lagi lah. So tahun 83 SPM. So I was offered, I ingat lagi masa tu I was a Petronas scholar. Dia offer pergi overseas ni based on trial exam. So based on trial exam, I memang dapat 10A juga in trial exam. So masa SPM habis 2 ke 5 hari bulan 12 tahun 1983. 1 hari bulan 1 1984 sepatutnya saya mendaftar di University of Otago, New Zealand. Petronas hantar, apa dia punya, of course to do A-level, tapi dia punya tiket tu was engineering ataupun accountancy. Saya said I want to do medicine. Dia kata no. Medicine kita tak sponsor sebab mahal sangat. Tapi I ingat sama officer 2 orang tu kata, you ni Harlina, pergi je buat A-level kat situ tu, Otago tu, nanti you mesti dapat full straight A's ni, you boleh masuk medik, we will sponsor you. But as a 17 years old, I was smart enough to ask them, tapi kalau saya tak boleh, mana tahu saya sakit ke. I was only 17 kalau macam tu jadi engineer lah, tak pun jadi accountant. And to me, no, I want to be a doctor. So saya tolak yang tu. And a few more lah lepas result keluar semua-semua. So, and one of the reason why was because of that. I want to learn to be doctor where I'm going to practice. Okay, so ada kawan-kawan saya, ada ramai juga pergilah. A few of them actually took my place to go. In first year going to second year, I was offered to go to Aberdeen. Tapi masa tu bapak saya dah tak sihat. I'm very close to my father, so I said no, I'm going to stay. So kawan saya yang pergi, a few of them. Bila balik, masa tu saya dah 2 tahun MO. Sama bayar umur, tapi dia orang balik, dia orang jadi houseman aku. Bukanlah apalah, tapi bila buat round dia ikut. Okay, seen by Dr. Harlina. Kau tulis memanglah kena macam tu lah kan, sebab saya senior dia in terms of the service. Macam tu je lah But it's okay actually, it's okay. But I practically teach them what are the things that they have to look for. But Alhamdulillah, my friends were so humble, and they want to learn. Korang janganlah sombong, ini baru MO nak ajar ke? No, tahu. Tahu apa? Kau memang tak tahu pun. Buatlah gaya betul-betul. Be humble. At the end of the day, it can be a horrific health system, whatever. But if you have the right attitude, you will survive wherever you are. For those yang ada the right attitude, don't worry. The first 2 weeks of your service or your kerja dekat that unit is to impress them that you are reliable, you are teachable, you are pleasant enough, you want to learn, and you are not the type of person yang missing in action. Tahu tak? MIAs. Okay, I nak pergi naik tau, mandi side. Berapa lama doktor? Sebab dia tahu ni, dia hilang je kan. Mandi sekejap lah. Okay. Bila tengok sejam tak turun. Masuk sejam setengah, call bilik dia. Rupanya dia hang up tu. Masa tu, those were the days without the handphone semua lah. Sekarang tak boleh, aku tweet kau. There's no more excuse, I am uncontactable. Mana boleh? Kau kat FB pun aku boleh message kau. So sekarang tak ada reason dah. We all dulu macam tu off kan hook tu. Kita memang houseman kena letak nombor extension ni kan. So apa yang buat? Ketua jururawat ni naik tingkat atas tempat houseman, ketuk pintu. Tunggu dulu. Doktor, I know you're inside there. Come out. Macam itu sekali tu. Mana you pergi, you can bagi tahu orang. Even you pergi bilik air tu. I have a very classical example. I was in the labour room, another houseman. We all masa tu ada 2 unit, UKM, KKM. So KKM unit tu another friend of mine. I yang jaga UKM. Dia punya patient suddenly dapat shoulder dystocia, tahu? Yang keluar kepala, bahu tak boleh tu. And it can kill the baby. It was a emergency, obstetric emergency. So panggil doktor, tentulah Doktor Yazan contoh Doktor Yazan. Tak ada menau. Mana dia pergi tadi Tak tahu sebab tadi macam mana kan. Dr. Harlina. So I kena samalah. Sampai konsultan semua dah turun. Rupanya tiba-tiba dia masuk je. Apa ni? Dia kan mana kau pergi? Aku kan bilik air tu. Dia rupanya sakit perut duduk dalam bilik air tu, tapi dia tak bagi tahu orang. Honest to God. Maknanya you nak pergi mana pun you kena bagi tahu, especially kalau you jaga labor room. Betul dia jadi doktor ni? Macam itulah dia Okay, next. Now, yang ini ni macam mana you punya access to the health system. You go to the Ministry of Health. Dekat rural, yang primary healthcare tu sama ada rural atau community clinic atau juga health clinic atau health center. Dia serve about 1 to 4,000 population. Naik atas sikit, dia lagi sikit lah macam tu Lepas tu ada hospital without specialist, hospital with specialist, hospital with subspeciality macam tu. And then kalau tak pun you tak nak pergi to MOH yang public ni, you can go over here. GP, kat situ Dr. Hafizah ada kat situ. Dan Dr. Hafizah can actually refer ke mana-mana je. Atau you pergi jugalah ke hospital, private hospital. Unity Hospital is actually put here. Macam IMH UKM semua lah. Okay, next slide. Yang ni health profile. So first for me to say, Malaysia is one of the country in the region with the best health indices. Our infant mortality, our maternal mortality comparable to check most probably. So kita memang health system kita one of the best. So tu yang very important to produce extraordinary, efficient and good young doctors, because we need to keep these health indices at that standard. Okay, next slide. Yang ini you tengok ya, antara public dengan private sector tu, unfortunately ya, kat public tu memang dia serve lebih ramai, tapi doktor ni makin berkurang sebab majority pergi ke health, pergi ke private. Ya. This one I tak boleh komen sangat lah ya. Kadang-kadang tu you have your own needs and everything kan. Okay, kalau misalnya pakai sikit point macam I ni dekat public hospital ni ya, university hospital is considered public hospital lah ya. Kalau I keluar ke private, berapa agaknya gaji I? Teka-teka sebulan dekat private obstetrician and gynecologist. Kamu gaji? Halizah, berapa agaknya gaji saya sebulan? Berapa 4 figures tu? 4 figures can be like from 99,000. 4 figures? 4 figures. 5 figures. Tak nak lah, tu korang punya gaji je. Okay, let's say it's 5 figures definitely. Berapa? 30? 50? Lagi? Lelong berapa? Okay, average ya 60 to 70k. Ada my friend yang memang dapat 100k, tapi kerja macam lipas hudung lah. Work very hard but hardly can enjoy her money. Pension ramai memang 100k boleh, 60-70. Tapi kalau dekat private dekat public hospital, berapa agaknya gaji I? Okay, alright. Yang itu you kira-kira lah, maybe macam 1/5 or the most 1/4 lah. Ya, naik sikit sekarang ni, but definitely I can say about 1/4 je lah. 1/4 tu pun banyak tu. 1/5 lah, 1/5 ya. And remember, kalau misalnya doktor yang dekat private practice ni, dia buat servis saja ya. Tengok patient je. Kalau lah patient yang beranak, dia patient nak buat Caesar, dia buat Caesar. Caesar mahal sikit lah ya, daripada lahir biasa ya. So semua patient dia Caesar. Ada juga, which is unethical. Tapi kalau macam saya, in the public university, I have to do my service. I have to teach my student. Postgraduate, undergraduate, postdoctorate pun kena ajar. I have to do my research. Kalau tak, apa yang ada kat dalam medical journal tu, kalau tak we all ni yang buat research. For that many job, we were paid that much. So I do not know lah whether you understand this or not, but I think some of you do understand, some of you might find it very difficult. It is definitely not about the money. Okay, so next slide. The current challenges in Malaysian health system, saya ambil slide ni daripada Datuk Dr. Maimunah ini izin dia. Lack of integration, nampak tadi cabang-cabang kan. Changing trend in disease pattern, greater expectation from public. Kalau patient you kan, dia datang, dia bawa one whole file, dia punya internet research dia. Katalah nak pakai contraception, Doctor, I've read about this intrauterine contraceptive device. There's another one which is actually intrauterine system, right? Wah, dia tahu macam, alah medical student aku pun tak tahu. Sebab dia dah buat dah that search. So they have a lot of expectation. Dependency on government subsidized services ini jadi isu lah. Kita kalau nak suruh bayar RM1 pun, ni hospital government ni RM5, orang komen lah ni. Kalau pergi private, boleh pula. And that is the mentality. Hospital private tu lagi baik servis dia. Padahal tak mestinya. Doktor-doktor kat situ kadang-kadang tak pergi pun CME. So dia tak guna yang the latest. Yang the latest yang dekat public tu, especially public university school. Sebabnya memang kita kena update kita punya knowledge. Limited appraisal reward system, conflict of interest, macam-macam. Next slide. One care, okay. One care ni anak-anak is still not actually implemented. 2 tahun lepas dia kata tahun 2012 ni, tapi 2012 dah dekat separuh ni pun tak apa-apa je lagi. So I do not know lah. So I cannot say much. But what is it actually? Next slide. So this is the proposed model for Malaysia. Next slide lagi. One care is restructured national health system macam NHS di UK. That is responsive and provide choice of quality health service. So you actually boleh pergi kat private without having had to worry about the money. Orang yang private pun boleh pergi dekat public, cross place macam itu. Dan yang bayar tu bukan dari pocket you. Contohnya macam itulah. Okay, next slide. And this is the target, universal coverage, macam-macam. Next slide. So, ini kononnya kalau misalnya it works, this is actually the benefit, yeah. I'm not going to go further because you can find this in the internet, yeah. Okay, next slide. Now, the compulsory service for Malaysian doctor. Okay. Buat masa ni, you have compulsory 3 years service. Okay. But the proposed, yeah, even though it's 3 years, you have 2 years housemanship, yeah, or internship, and the 2 years as a, yeah, MO. This is to fulfill, yeah, the requirement and coverage. Now, after 3 years, kalau you nak resign ke apa, boleh dipertimbangkan. Ya, tapi kalau you dah memang serve 2 tahun SMO, lagi mudahlah you dah dipertimbangkan untuk dilepaskan jawatan. But of course, you are bound to your scholarship and everything pula kan, ya. Okay, next slide. This is the medical school in Malaysia. Ya, yang ni ada tambahan lagi tu, tapi tak muat dah tempat tu. Every year we produce like 3,000 close to 4,000 new doctors. Tu belum lagi yang datang daripada Czech Republic. Ni Czech Republic nak join the bandwagon kan. Okay. So, next slide. Now, this is a website you need to go in. MMC, yeah? Malaysian Medical Council, Lembaga Perubatan Malaysia. MMC is the one that regulate you, yeah, as doctors, regulate me as doctors. You only could practice once you are licensed by this. Yeah? So kalau you tak license, you are a quack doctor. Okay? So how are you supposed to be licensed by this body? Okay, next slide. You tengok dalam internship dia tu, yeah, you scroll tengok internship. Dia kata, pursuant to the Medical Act 1971, yeah, internship is a period of structured supervised practical training after graduation. I do not know how Czech Republic in system, ya. Section 13 dalam kurungan 2 of the Medical Act 1971 dictates that fresh medical graduate shall undergo further training for the purpose of obtaining experience as a house officer, which includes 4 months posting in surgery, orthopedic, medicine, pediatric, ONG, and emergency medicine. Emergency medicine, A&E to medicine. The noble aim of internship training is to provide fresh graduate with an educationally sound experience that professionalizes new medical graduates not only with appropriate knowledge, skill and experience, but above all, attitudes. I lupa nak boldkan tu. Siapa ngantuk bangun? Yang ini you kena tengok betul slide ni, betul nak tidur balik boleh. So, the purpose of your internship is to mold your attitude, ladies and gentlemen. Above all, your attitudes. For those of you who already have good attitudes, this is going to be just a breeze. You'll enjoy your housemanship like nothing else. But if you are having a very cranky kind of attitude, this is going to be hell. Yes, welcome to hell. Macam tu pula, ya. And that is proven. Yeah. Pasal you all discuss, why are we having so much problem with this house officer? Dulu tak, ya, tak berapa fair juga lah statement tu. Dulu houseman berapa ratus orang aja. The problem ada, cumanya ya masa tu kita sikit. Jadi seorang doktor kat HSA Sultanah Aminah ada problem, seorang doktor kat Kota Baru. So it's macam ni. Sekarang ada 9,000 house officer for the timing. Ya, first and second year 9,000. Ada department tu crawling with house officer. Ya, house officer lagi ramai dia patient. Seorang patient 3 house officer jaga. Itu pun not done. Things are not done. Ini yang phenomenon. I thought somebody thought everybody is doing it, and somebody lama-lama nobody. That pernah nak dengar kan? So kita kata, okay, siapa patient ni? Semua diam. I want to know whose patient is this? They are not here. Where are they? They have gone here lah, there lah. Semua. How about you? This is not my patient. Allah, geramnya. Masa we all dulu seorang je house officer throughout the ward, semua kita kena tahu. And I have managed. Sorry lah ya, I tak suka cerita ni. I'm sure Dr. Halizah pun. It's like macam cerita apa? Rekod buruk During my time, you akan roll your eyes, ya. Ini tu dia sifat bila ni. Memanglah. Tapi macam mana lah nak cerita? Nak ceritakan korang, you all punya kerja as health officer sekarang ni, yang you rasa teruk sangat tu, it's like macam ni ya, kalau you dilute something in the water, it has been diluted 1,000 times. Oh yes. I do not want to waste your time telling how I and Dr. Halizah went through. Dia punya housemanship dekat Melbourne. Sama ni? Separuh-separuh lah ya. And then sikit lagi. Tapi I memang totally I was trained in HKL and I was also a house officer there. And at that time I was the MO of the intensive care unit of the busiest ICU in the whole world. Masa tu memang lah masa tu kan. Oh yo. Masa we all buat tu memang rasa, what am I doing? Masa I buat ONG, our patient can be 70 patient per night. Untuk postnatal care. So, katil tak cukup, canvas bed. Itu tak canvas bed yang macam orang kat military training tu, yang buka tu. Ini patient baru salin ni. Katalah bed. So, rapat-rapat, tengah-tengah ni lagi. So, bila I jalan buat round tu, ada mother ni pegang kain. Doktor, saya sakit doktor kan. Ni kalau lepas bersalin you have this macam this menoric pain kan, uterine involution. Doktor, saya sakit doktor. Kejap ya puan, nanti saya ambilkan ubat ya. Okey. Ingat ni bed berapa ni kan? Tak ada nombor dah kan ya. Lepas tu jalan selang ni sikit, tarik pula doktor, anak saya ni kenapa dia macam macam biru sikit. Biru kejap je kita tengok sakit. Ya Allah kan. And I had with tears rolling down my cheek. Lalu kat situ I cannot do much. Kadang-kadang pergi bilik air, had a good cry, baru keluar. But we have to do that. Itu 70,000, belum 70 baby dia lagi. And I have to see all of them before they discharge. And just pray to Allah, ya Allah, hopefully all these babies are fine, ya Allah. None of them that I miss anything. Balik tu tak terus tidur. Macam korang sekarang ni ramainya balik terus tidur kan? Tak ingat dunia dah. I was married. Memang tak ada anak lagi because I planned my pregnancy. But I have my husband. Every 3 nights I will be sleeping in the hospital. My husband orang kata, oh Ustaz, ini bukan control, dia remote control. Pergi kerja bawa beg baju. Sampai neighbor sebelah kata, Ustaz, isteri Ustaz tu kerja apa? Oh, isteri saya kerja doktor houseman. Bukan lari dari rumah tu kak. Macam-macam lah. And then sometimes pukul 3 pagi ring bunyi my husband telefon. Dah makan? Belum, tak makan lagi. Tak apa. Kan dia bawa lah sup. Bawa 2-3 sup untuk doktor yang lain, nurse yang lain. So you makan sekejap kat pantry. Dengar sayup je bunyi kereta then suddenly esok pagi dah start datang balik. You boleh balik sekejap mandi. Masa you all dulu on call, maksud dia macam ni, masuk pukul 7, houseman masuk pukul 7 tau, bukan pukul 9. So Sultan masuk pukul 8, houseman datang pukul 9. Mana boleh macam tu? Kenapa dia datang pukul 9? Oh sorry, I cannot get up before 8:30. Banyak cantik muka kau. So jadinya pukul 7 dah dekat ward. Saya try on call petang tu. Orang lain balik, sedih sangat orang balik. Sebab dia kan, orang pass over. Tengok patient aku tu dulu, bye bye kan. Nangis kan. So guys, tak apa, stay back, malam tu pegang pager. Masa I houseman dulu, I student dulu, I rasa coolnya orang pegang pager ni. Look so important. Saya tak pager bunyi. Tengah cakap, kejap, pager bunyi. Galau kan. Bestnya. Tapi bila aku sendiri pegang pager, masa tu rasa yang boleh tak flash pager ni kat bilik air kita tengah buang air sedap pager bunyi kan. Ingat lagi lah. Lepas tu you tend to remember the number, the extension of the ward. Kan kat bilik 6314 tu labor room. 6310 is to OT. Tiba-tiba pager 6310, apa pula kat OT ni kan. Macam tu lah macam tu your life. And then nanti throughout the night macam-macam lah. I ingat lagi I take over ward. Kawan kata, aku ada 30 canvas bed. Kau jangan tambahan canvas bed tu. Esok pagi aku tengok, yelah, dia tengok esok pagi I pass over kat dia. Okey, aku guna semua canvas bed kau. Aku punya 5 lagi dia buat sebelah. Lepas over, Aduh. Memang tak tidur sepicing pun. Tak sepicing. Tidur, tak tidur. You dah kelak. Okay, lepas ni I just mana have a break sikit je jadi. Tiba-tiba, staff dah datang lagi. Doktor, lagi 5 nak kelak. Solat dengan baju ni. Tapi bilik meja sister tu, meja kat office sister tu, solat. I pernah kelak tertidur. Pakcik doktor masuklah tidur. Pakcik sihat ni. Doktor masuk. Aduh. But those one ni lah, every time I walk through HKL nowadays, those are the places that make me a doctor now. Now currently 41 hospital being approved by the board, NMC, for the purpose of houseman training. Next slide. Now medical qualifying board, this is actually the committee yang decide, has determined that the committee for the houseman training has the right to determine your discipline placement. Ini kat Ministry of Health. You will be allowed to proceed to the next discipline if your supervisor is satisfied with your knowledge, skill, competency and attitude. You might be knowledgeable, you might be skillful, you might be competent, but attitude sucks, stings. Tak boleh lah, you kena extend. The committee has the right to determine the duration of your extension period. Kadang ada yang kena extend another 4 months, dah ada on top of the 4 months. If you do not satisfactorily complete any or all of the internship training requirement, you will not be eligible for full registration. So apa maksud dia? You are only partial registration. Pendaftaran sementara. Full registration tu hanya selepas you habis your internship. The total duration of your internship training should not exceed 6 years. If you are not able to complete within the said period, you are not eligible for full registration. For that matter, you need to appeal. Tak boleh diajar ni, ajar pun tak makan juga sampai 6 years. Memang you are not cut out for the profession. Next slide. Okay, this is the guidebook for house officer. Please look at this, especially the final year. Next slide. Yang ini nanti, the goal of internship, apa semua lah, locum ke apa-apa semua tu ada kat situ. Okay, next slide. Shift system. Okay. Now, I am definitely not the best person to explain this because satu, saya tak go through this shift system. Yang macam I punya, maknanya bila I on call, the next day bila kawan-kawan masuk, I terus juga. Tak ada post call punya, off tak ada. So, bila you on call, you are working 32 hours, not less. Not less than 32 hours. Katalah you have EOD call, what does that mean? Every other day call. Maknanya on call hari Isnin, hari Selasa balik rumah, Rabu on call lagi. So cerita dia macam ni, pagi Isnin you bawa bag call kan, petang Selasa you bawa bag balik, tidurlah kat rumah. Esok Rabu bawa bag lagi. Itu yang neighbor I kata, doktor kerja apa si doktor tu, macam lari dari rumah je tak habis-habis kan. So itulah dia. And then kalau you, itu EOD tu selalunya kalau you nak ambil cuti contohnya, you have to actually do all your call. Kalau tak seminggu tu 2 atau 3 kali. You have to be doing call on weekends as well. I dengar ni semua tak payah dah, sebab you all complain banyak sangat lah. Masa you all dulu you all complain juga, tapi entah rasa macam if people can do this, why can't I? Ini yang complain mak ya. Doctor, you shouldn't put my daughter on call twice a week. Banyak cantik Kenapa makcik nak buat call dia ke? Mak yang datang ni, datuk bapak datang. Kami korang ni aduhai, lemeh betul, lembik betul. So this is the new requirement. You cannot blame the Ministry of Health for such a harassment. Tahan dia nak tunggu 9, nak menadah 9,000 orang komplain ni. So fine dia kata, since you all nak sangat, ambil ni. But this is definitely at your disadvantage. Sorry people. Alright. So each houseman, dia kata, should not have less than 60 hours of call a week, or not more than 78 hours. Now, I tak boleh kira berapa hari your call, because the shift now is not as macam I dulu. Kalau you all dulu boleh katalah 1 or 2 calls per week. Faham maksud dia? Kalau satu call 32 hours. Sekarang ni tak, because you have either 2 system, 2 shift system. Masa I nak datang sini, I call my friends, pengarah kita. Kau cakap kat budak-budak tu, tak apa, how biru ni sini. So and it's still very new. So tak tahulah apa impact dia kan. Of course it is responding to that complaint that you are tired, you ada yang pergi International Labour Organization sampai complain. We are like donkeys. Kerja macam nak arak lah apa semua. If you are like donkeys, we were like donkeys as well. Even worse donkey kan. Right? Maybe you can say, alah doktor, you generation dulu tak voice out your worries atau ni. No. You didn't get our point. Agaknya we have accepted that these are the things that are going to correct our attitude and make us a good doctor. Wallahualam. So, two shift system, you ada AM shift dengan on-call shift. AM shift ni 7 to 5 to 6 PM. Depending. But siapa yang on-call shift, dia masuk kerja pukul 4 sampai pukul 8 the next morning. Dan siapa yang buat on-call shift hari tu, they will have post-call off. Wajib ni, mandatory. Faham tak ni? Tak faham macam ni. Katalah kat sini ni nak buat, you all kena pilih lah. I buat AM call, I buat AM shift hari ni. So you punya kerja pukul 7 masuk sampai pukul 6 you balik. Yang this hari ni, this group buat on call shift. So you masuk nanti pukul 4 petang, tapi you balik esok pagi pukul 8 atau pukul 9, depending lah. Kenapa ada overlap kat situ? Of course kalau you balik pukul, you habis pukul 8 pukul 9, kawan you yang AM dah datang lah pukul 7 tadi. Ataupun nanti kalau you dah nak balik pukul 5 pukul 6 petang tu, kawan you yang on call shift dah datang lah pukul 4. This overlap is meant to be for passover. You kena passover. So siapa yang you only on call shift pukul 4 masuk nanti sampai esok pagi, tapi lepas tu esok pagi tu you off. Tak payah kerja lah. Best lah kan? Boleh tengok wayang, bolehlah pergi spa, letak timun dekat sini tu, manicure, pedicure. Sorry lah kan. Sorry if I sounded so irritated. I'm sorry. Because most probably I try to be in your shoes, but this is just too much guys, for us lah, Why? Because, okay, let me talk about the restart later means. Okay. Yang 3 shift system pula, first shift 7 sampai 5 petang. Tu shift pertama. Now, shift system ni macam nurses. Cuma dia lain sikit hours dia. Nurse kita ada 3 shift. Okay. First shift 7 to 5 PM. Lepas tu second shift 4 PM to 10 PM. Third shift adalah pukul 9 malam sampai 8 pagi esoknya. Dia ada overlap juga. Pukul 8 you boleh balik, tapi kawan you yang morning shift dah datang pukul 7. Dia pass over 1 hour tu. Okay, apa setback dia? We have suspected, we have to do a research lah after a few years or a few months of this shift system, that we are so worried about your learning curve of taking charge and managing patient as a whole. Sebabnya you pakai shift aja. Katalah patient you masuk, katalah mau 2 shift tu, patient you masuk pukul 9. Apa jadi kat patient tu? You sampai pukul 5 sampai pukul 6 je. Lepas tu you pass over kat yang on call. Okey lah, macam biasa lah juga pass over kat yang on call. Tapi katalah the next day you pula shift on call pula contohnya, So you tak datang pukul 7 tu, and you might be posted to a different ward. Ward dulu jadi house officer tu, itu tu ward P3. Dia punya sebelah tu dalam kurungan Harlina ada kat situ. Tu ward I tu. Maknanya I know everything that happens there. So pakcik tu masuk berapa hari bulan, discharge, semua I yang tulis. So I know the whole spectrum of the management. Sending the patient to CT scan, I juga yang send. Getting the result for the CT scan, I juga yang cari. You all nanti tengoklah you shift tak hari tu. Kalau you shift yang ni, okay, yang kita, okay you Houseman call okay, you ambil try to get this result from the radiologist. So you call radiologist. You kata, okay, I want to trace this radiology report on this patient. Okay, tell me about this patient. I don't know. This patient actually come last shift. I'm only on this shift. You know that kind of thing. Dia dah tak bunyi lah. Kita tengah operating, my surgeon friend tengah operating. Kau tahu hari dulu Nurses je kata, okay, doktor, prof, kata, I'm off duty, my friend is taking over, ya. Okay, bye. Kan? So, boleh masuk. Sekarang bukan nurse saja, houseman aku pun cakap macam tu. Doktor, okay, I dah off shift, ya. Okay, bye-bye. No houseman aku. Macam mana you nak learn what am I doing here now? The nurses okay lah, fine. But you all as a doctor, you see a hysterectomy in the first part, and how do I close the vault? You tak ada. Maybe next shift lah ya, yang mana orang lain yang start, you pula tengok you close, ya. Macam mana you nak belajar tu? Macam mana buat the post-operative care? Well, having said all that, I think you just have to cope with it lah. But definitely you have more time lah ya, for movie, ya, untuk main FB kan. Kalau tak kan you ada withdrawal symptom kan ya. Kalau tak ni kan. And then finally, ya, nak pergi spa ke apa tadi tu kan. And we hope that it will translated into a better service. But I do not know whether that is possible or not. Yang I bimbang nanti, your experience in patient care is so lacking that when we send you to the periphery as MO, you are just going to be so scared lah ya. Okay. Now, I'm not trying to make you feel scared atau tak nak balik lah macam ni, no. With this kind of shortcoming, of course there is also advantage. So use the advantage to your own. Cumanya I kata attitude. Those who have the right attitude, that in the attitude tu we talk about the next lecture. Boleh? Yeah, I'm so tired already. Okay, next slide. Okay, yeah. People may not remember what you said or what you did for them, but they will always remember how you make them feel. You know? I'm sure you might not remember what I just said. Yeah? Malah ni ingat lagi lah, kau besok tak ingat lah. Yeah? But what you will remember is how I made you feel with what I said or what I did. So, apa juga dengan doktor ni tau. Patient you kadang masuk tu langsung macam nak mati lah. Tapi you punya incubate lah, you bagi apa-apa semua. Balik dia jalan 5 hari lepas tu. Dia tak kata tu, terima kasih doktor, nasib baik doktor ada. Tak ada, masuk keluar biasa je. Dia kata, pakcik ni ya. Itu biasalah ya. People may not remember what you did, but if you are an exceptionally awesome young Malaysian doctor tadi, who is extraordinary in terms of your care, your patient will remember you. Ya, I kalau pergi Kelantan Dr. Halizah tu, ya, agaknya satu pasal Sir Halizah tu kena ada. Panggillah doktor kan, pasal of what she did to them. Macam saya pun pernah sekali beli sayur, tiba-tiba RM7 dia pusing. Tak apalah doktor, RM6 cukup lah. Mana dia tahu doktor? Aku pakai name tag ke? Tak ada kan? Tak pasal. Alah doktor, saya ni lah. Sebut nama tu bawa saya teringat. Ya, dia dekat ward 2 bulan placenta previa, ya, bleeding placenta previa. So we cannot discharge her. Tapi masa kat ward dengan pregnancy-nya, dengan make-upnya tak ada kan dia. So tak kenal, ni dah langsing dengan make-up semua. So kita perasan. Tapi dia tegur kita. Ya, dia tegur kita doktor, dan murahlah RM1.50. Ya. Those are the things that you can do. Ya. At the end of the day, I said, welcome, and be my colleague, because this is one of the most noble profession that the world can see. But I am begging you to help me and the rest of the doctor who is already in this fraternity to keep your professionalism. Otherwise, by the time you are my age, this profession is not as noble as before, and it's actually in your hands, no longer in mine. Yeah, so with that, I thank you. Ya, minta maaf kalau tak ambil masa sikit, ya, tapi I'll see you in the next one. Yeah, you're gonna have enough of me today. Yeah. Assalamualaikum.